Welcome everybody to Go Local Live. I'm Josh Fenton, CEO and co-founder. It is Wednesday morning. We've got Dr. Phil Chan. Dr. Chan joins us pretty much every week to talk about the biggest issues affecting Rhode Islanders relative to health. Dr. Chan, thanks so much for joining us.
Thank you for having me.
All right, let's jump into it. We really wanted to talk about the issue of addiction. We've seen these sort of waves come through Rhode Island of different drugs impacting folks. And this has been sort of this constant roll through over, about the last 2 decades?
Yeah, so this is a very important issue. There's a significant number of adults here in the US, including Rhode Island, that report using drugs at least at some point in their life. And the big issue has been that our drug supply, both in Rhode Island and nationally, has really been adulterated by a number of these very deadly substances like fentanyl that's killing people across the country, including here in Rhode Island.
And let's take a little bit of a historical look. I think the big one, there was always sort of heroin or crack cocaine, but the ones that sort of made the mainstream and sort of, took over the public attention was opiates. And that started 15, 20 years ago. Walk us through that and how we've gotten to today.
So 15 or 20 years ago, myself included among other doctors, we weren't aware of all the potential ramifications of all the opioids that we were prescribing. And it used to be pretty commonplace for us to prescribe them for a lot of minor things. And a lot of this was fueled by the pharma companies, by a lot of advertising and marketing. And again, most of us didn't realize the potential dangers. That led to a number of folks everywhere, patients that were addicted to these opioids. And a number of them over time transitioned to heroin, of course, street drugs, which have been contaminated, which eventually led to the fentanyl crisis. And fentanyl is an opioid. In fact, we use it in the hospitals all the time. It's one of the most potent opioids that we use. And in fact, such a small amount, like the amount on a tip of a pencil, can potentially kill someone.
And where did fentanyl come from? I remember there was a story that sort of the first outbreak in the United States of sort of street fentanyl, I think came out of Burrillville, Rhode Island, when Dr. Fine was the director of health. That was sort of the initial sort of this thing developing into a real sort of unregulated problem. How did we get from there to what we've seen? There's been slight improvement in the last 2 years, but on a national level, as many as 100,000 people a year dying from overdoses.
Yeah, this is something that has evolved over time. People have a desire for more and different drugs. Fentanyl is one of them. Xylazine, people may have heard of, is another one that's been used more commonly. Here in Rhode Island, we peaked in 2022, we peaked at 436 fatal overdoses in the state. That's more than one a day. Now, the good news is that we've seen that number come down since then slightly through 2023 and 2024. So we're definitely making progress, which is a good thing.
And what's been the strategies that have helped that decline? Part of it has been greater awareness about legal opiates per se and changes within the strategies, lawsuits that force some of the strategies as well. So that's a portion of it. Relative to fentanyl, what have been the strategies that have worked?
So that's one thing that I'm very proud of for Rhode Island. Rhode Island really has a whole of government approach to addressing the opioid crisis and other substances here in the state. We have a governor's overdose task force led by one of my colleagues, Kathy Schultz, the health department, UHHS, BHDDH, really a whole of government approach. And it's really focused on reducing fatal overdoses in the state, right? We got to keep people alive as a first step. We also have focused, of course, on prevention, harm reduction, treatment, getting people into recovery, and as sort of next steps to keep people healthy and safe.
And how much of that, and is it at risk, has come from the federal government in funding, and is that being now potentially lost under the changes of administration and the changes of strategy of spending?
Some of this is funded by the federal government. Some of this is also funded by some of the opioid settlements, done by the Attorney General. But we do get a significant number of grants, similar to many states, to address substance use. So any cuts to the state really do affect all of us and our ability to respond in Rhode Island.
And is there thinking going on right now that, hey, listen, if in the next 12 months we lose significant federal funding, here's how we're going to address that issue, here's how we're going to backfill, here's how we're going to rethink how we're bringing these programs forward?
Well, luckily, we still have tens of millions of dollars as part of the opioid settlement funding that we have, which is good news. I think we're going to have to see what happens with the federal government, with the different granting agencies. I think, though, as a state, again, Rhode Island has really been a leader in this regard. What we do need to do in terms of the next steps, in my opinion, is to really get more primary care physicians involved. We need to lean more into things like prevention in terms of getting people before they get to the point where they're having an overdose or potentially a fatal overdose. There's a number of things we can do within states together, which has been great in what we've been doing to date.
24, 36 months ago, there was a lot of education, a lot of push about getting distribution of Narcan. Where does that sit today? How well distributed is it? Who has it? Who doesn't? Who should have it?
So naloxone, also called Narcan, is an opioid antagonist, meaning that when someone is having an overdose, when they've taken too much of something, is that Narcan will reverse that. It's one of the safest drugs that we have. In fact, it has no side effects other than directly acting against opioids. So when people have taken an opioid, administering naloxone, usually through a nasal spray, is really effective in reversing it. Through the opioid settlement dollars, we have had a lot of free Narcan available in the state through partnerships with the health department, with the University of Rhode Island, who's helping to distribute it. So our sort of approach in Rhode Island is that everyone should have access to Narcan, even if you don't really think that anyone is at risk. And the reason for that is because a significant number, over 80% of overdoses, are in private residences. And I think that if you are in this field or work in healthcare, you know people that have lost a loved one or a family member or a friend due to a drug overdose. So I'm really encouraging folks to get out there and just have access to Narcan. I carry some in my car, in my bag, at all times.
And should the average person, should Josh Fenton have some in his car? Should he have some in his backpack?
I encourage people, especially those that live in urban centers here in the state, to actually carry some around with them. We do see the highest rates of overdoses here in the state in places like Providence, Woonsocket, Pawtucket, Warwick, etc. So if you live in one of these cities and work out there, I would encourage you to do so. And certainly if you know anyone in your networks, in your family, kids, etc., you definitely want to have some available just in case. You just never know.
So we've done a good job in the last couple of years in getting the number of deaths down from a record high in 2022 down lower. I think it's declined by about 20, 30%. How do we get it much lower? How do we not, I think we have a tendency to sometimes say, hey, we got it down a little bit, but we didn't really get it down to where potentially it could be. Is this a number, that 460 number or that you quoted, is that a number that we can get down to 10 overdoses a year?
I hope so. I think we have to invest and focus a bit more in prevention. I think that we've been very active in addressing fatal overdoses, right? Keeping people alive, which makes sense. I think we have to look a little bit earlier on. I think we have to do a better job of talking openly about this in schools, doing prevention in, for example, high schools, and also engaging just our general primary care community, healthcare professionals. I think that we need to do a better job screening and just having talking to people about these issues. I think that's sort of a sense that people may use drugs once in a while and it may not be a problem. But I'm also reminded that there's not really a safe amount of some of these street drugs. And one of my worst fears, certainly as a parent, is that my son or my daughter may inadvertently, take a Percocet or a Vicodin or Ritalin, right, that may be laced with fentanyl. And we've seen it where just taking one pill can kill someone. So even people who are using these substances once in a while, who don't think they have a problem, should really be aware of the risks and consider at least talking to a healthcare professional, a primary care provider about it.
There's still a big stigma with it. You know, you see it, we run obituaries for free, and you see it of these sort of 20-year-olds to 35-year-olds. Some families say it was because of a drug addiction. They make sure it's right in there as a cause of death to try and destigmatize it and to educate their friends and families who might be reading the obituary. Do we need to really sort of rethink how we talk about these things?
There's certainly still some stigma, some shame in talking about substance use addiction. I think, we have to remember that addiction is really a disease. It's one of those things where there's some people who can, take a Percocet or a Vicodin and not have any, long-term consequences, not feel addicted, not feel the need to continue taking it. There's some people that take those medications once and they get addicted and they can't stop. And they got the prescription maybe initially for something legitimate, a broken bone, etc. So I think we have to think about this as a disease. It's related to genetics. It's not something that people can always change. And I think that helps to think about this in terms of addressing stigma and shame.
Is healthcare still there? I mean, I'll give you a personal member of my family was injured, repeatedly said, do not give any opiates, don't want any prescription of an opiates. I said it, the individual said it repeatedly, and in the bag going home was a giant pill capsule full of opiates, despite saying it over and over and over again. I was absolutely shocked. This was at Rhode Island Hospital. I'm not sure, is it always getting through to the healthcare professionals?
I really do think healthcare professionals have stepped up in terms of recognizing this more and being more careful in prescribing opioids. Certainly for folks that are just have major surgery, for folks that have cancer or end stage disease of some sort, most of us are relatively more liberal in terms of prescribing opioids. But in terms of going to your physician and having back pain or headaches or other a muscle strain, etc., most of us are no longer prescribing opioids for that. I still get a lot of requests about that, but at least for myself, and I know a lot of my primary care colleagues, we're generally not using opioids for more mild things at this point. And I think it's well recognized at this point among most of my colleagues.
If you had a magic wand, wrapping up, and you could sort of change one other factor within our healthcare system, within our educational system, within society to help lower the impact of addiction, what would it be?
Two things. I think that we need to have these discussions on an ongoing basis in schools, in high schools. I think we need to talk more openly about the real world impacts of this, including treatment and prevention options. And I think we just need to increase primary care access in general. I really do think a lot of this, whether it be substance use, alcohol use, tobacco use, mental health, will at least start with having a healthcare professional, someone that you trust, that you can talk to, that you can have these open, transparent, honest relationships with.
Dr. Phil Chan, always appreciate you taking the time educating us about the most important issues. For everybody else, stay tuned. There is a lot going up. There is a ton of new content up on GoLocal, everything from the Trump administration cutting a significant number of NIH grants that are going to impact Rhode Island's healthcare system. Take a look at that. Also, America's got its first $100,000 a year university in the country. You can take a look at that and much, much more. Thanks, everybody. Stay safe, great weather, and enjoy the updates all day long on GoLocal.